one and all to the program of Master Trainer program on communication in healthcare. And I'm really thankful to you to have chosen to be with me for 10 weeks because people hardly have any idea about what clinical communication is. And then being ready to spend so much of time with me, investing so much of time with me is an indication that you really value clinical communication and you are really keen to learn this program. And I really assure you that you will be, happy and satisfied for the time that you are going to invest in the program. From Afghanistan, one participant from England, one participant from Qatar, and I think we have around 7-8 participants from the neighboring countries. So thank you to all of you to have chosen this program, to have enrolled for this program. It's not easy to have trust in a program which is not in your country, and then you have agreed to take this program. I welcome all of you. The program is designed in a manner that all of you interact, participate, enjoy, learn, and share your experience, because this is not something that I'm going to, I'm dealing with somebody. So can I request everyone to mute their device? Yeah, if everybody could mute their device. Okay, so I have muted everyone. In case if you need to speak, then you can unmute and please go back to mute mode. Okay. So before we go further, let's introduce ourselves. And much before that, I think I would like to give a technology reminder to all of you so that we all are on the same page. So give me a second to share the screen and share some technology reminders for everybody's benefit. Give me 1 second. Okay. So as I had mentioned you in the email also, that I would request everybody to join from the laptop, because when you join from the laptop, we'll be able to see everyone. So it's more like a virtual classroom. And if you will join from your phone, then you'll be able to see very little of each one of us, or maybe one speaker. And even the presentation will not be, that well visible. So I request everyone to log in using your PC or your laptop so that you can see everyone, and keep it on the gallery view so that we can all see each other and interact like we interact in the classroom. Keep your device on the mute mode unless you are speaking, and if you have to speak or say something, please feel free to unmute and speak and then go back to mute mode. Keep your video on, because and you will learn it when we'll do the program, that lot of interaction is non-verbal. Lot of interaction is through eyes. So it's very important for me to see you all and for you all to also see each other. So please keep your video on throughout this session, and therefore preferably sit in a room where you are not disturbed by anybody coming in and going out of your room. So that way you will not have any challenge of switching off your video because there's some noise around or there are people who are moving around. In case if you need to change your position because of the light or some projection reason, please stop your video for a couple of seconds, go back to the place wherever you want to sit, and then you can have your video on. And in case if there are messages in the chat box, please read the message in the chat box, answer to those prompts, because there will be questions, there will be answers and discussion around it. And preferably have your name written on the login so that we know whom we are interacting with, and that becomes easy for us to know each other. Of course, initially maybe 1 or 2 sessions we will take time to know each other's name and also from where we are. But I think with little time we will become familiar with each other. So a little bit about the group agreement that I think we'll all follow. Of course, I don't think I have to say this, but it's more like a reminder for all of us. So please speak for yourself and be mindful of others, especially when we have people from different cultures. So and different challenges and different positions and different designation. So we need to be really respectful of their profession or their background or their socio-cultural context. A lot of time you'll feel like sharing your organization's problems, or participants will share their issues and concerns. Whatever we discuss, that stays in the room. We will not be discussing their name or the organization name outside the discussion or outside this program. Plus, I would request everyone to participate, because if you will just passively listen, yes, there is learning, there's no doubt about it, but there's a lot more fun and learning when you actively participate. But of course, we need to remember that we need to give time to each one to speak, and also we need to be mindful of time, because I would have a lot of material to share with you. In case if somebody takes longer, to answer or to speak, then we'll be cutting down on the content, because I can't go beyond 2 hours, because all of you also, come and join the program after a day long of work. So I would not like to go beyond 10 o'clock. So please be mindful of the time and when you are speaking. And in case if there's an urgent call, please switch off your video and also mute your device. And if you need to take an urgent call only. I normally do not take call during the program unless it's very urgent or I just need to say something. Then all of you seem to be quite experienced, knowledgeable, and well read. So, but we are here to learn something new, which is probably different from what we are doing. So we have to respect that and remember that we are here to learn. And when you're giving feedback or when you're saying something, please focus on these strengths. Everybody has some strengths and some weaknesses. Every situation has some strengths and weaknesses. So we need to be mindful of that. We need to focus on these strengths, because that's how we create positivity and create a healthy learning environment. So when you're giving feedback, please be specific and non-judgmental. I know trust is learned and trust is earned, and it takes time, especially when I'm meeting some of you for the first time. It will take you time for you to trust me or the program and your fellow professionals. But have patience. I'm sure you'll be, happy, and you'll have trust on each one of us. So moving further, we'll introduce ourselves. One request that I have for everyone, that please limit your introduction to just 60 seconds. So I'll give you 1 minute time to prepare your introduction rather than you just speaking extempo. Take 1 minute time and write the key points that you want to talk about. What I mainly want you to talk about is, please tell your name, and then which organization you are or what is your role, and then something valuable about your name. So it could be, that what is the meaning of your name or what is special about your name, whatever you're comfortable sharing. And then you pass the baton to the next person, that, okay, I want Mr. So-and-so or Dr. So-and-so to speak after me. But the trick is that we have to limit it to 60 seconds. So I think I'll give you a minute's time to note down what you would like to speak in those 60 seconds. And then we will start this exercise. Is that okay? So I'm starting the count now, and you can start writing on your notebook what you want to speak in next 1 minute. Can we start? If everybody is ready. So I think I'll start the introduction and then I'll pass the baton to the next person. So friends, I am Dr. Indu Arneja. I'm a psychologist and a healthcare professional uh, and a trainer, I would say, in healthcare communication, because that's become my niche area of work. I'm a visiting faculty to a lot of prestigious organizations, including IIM Ahmedabad, Accelerate Jamshedpur, Delhi Judicial Academy, Maulana Azhar Medical College. I've conducted around 1,500 to 2,000 programs, and healthcare communication has become somehow my passionate area of work, and I really thoroughly enjoy working in this field. I have established an organization with the name Indian Institute of Healthcare Communication. And since I'm working with the medical students for almost 10 years, working on their communication skills, I came up with this book last year called Fundamentals of Clinical Communication, a step-by-step guide for medical students. So this covers almost everything that a medical graduate or a healthcare professional should know, how to go about communicating or handling or interpersonal skills with the patient. If you get a chance, lay a hand on this. The book has been priced very, very nominally, just 300 rupees. I mean, I think some of the websites are selling it even for 240 or 250. In case if you get a chance, go through this book, you will thoroughly enjoy and you'll get a lot of material. And the handbook that I have given to you also covers almost everything. So one philosophy that I believe in and which I'm going to really practice throughout my training program is that I don't believe that I can teach anything to anybody, and especially to the elite class that I'm dealing with. I don't think I'm here to teach you anything, but I assure you that I can facilitate your learning. I can help you think on certain points or areas which normally gets ignored or lost, and that's what you're going to thoroughly enjoy in the program. So about my name, Indu in Hindi, it's in English, it is moon. So what I consider that I am a moon. I take my light from sun. I pass on the light and peace, but not the heat to others. That's about my name. So I pass on the baton to Dr. Rajesh Nair to please go ahead and introduce himself.
Good evening, ma'am, and good evening all. I am Dr. Rajesh Nair. I am in the Adani Healthcare as the head medical administration in the Gujarat Adani Institute of Medical Sciences, which is a teaching hospital, 750 bedded teaching hospital. As ma'am has already directed, I should tell the meaning of my name. I hope the meaning of my name is the King of the Gods or the God's King. So with that, it's an honor to attend your class, ma'am, and I sincerely feel it's a pertinent subject to be spoken about as well as discussed about, and to be taught to all the medical professionals. Sure. And very heartening to find people from Afghanistan, because I was director of a medical mission there for 1 year way back. So and it's an honor to attend your class, ma'am. Hope to interact much more, ma'am.
Definitely.
Thank you very much.
Thank you so much. So whom do you want to pass the baton?
I'll pass the baton as per the seniority, ma'am. Dr. Farah is there.
Okay, go ahead, please. Dr. Farah, please go ahead.
Good evening, ma'am, and hello, everyone. I'm Dr. Farah Sullai. I'm working as a consultant biochemist in DMFR Molecular Lab Diagnostics in Dhaka, Bangladesh. Literally, the meaning of my name is Firefly, but it is actually referring the light in the darkness. I hope I will enjoy the program and learn many things. Thank you.
Thank you for being there, Dr. Farah. Thank you. So whom do you want to pass the baton next?
I think Dr. Vaivani Upadhyay, if I am pronouncing right.
Yes, Vaibhavi Upadhyay. Thank you, Farah. Thank you, Dr. Indu, for actually accepting the registration. My name is Dr. Vaibhavi Upadhyay. I'm an anesthesiologist and a clinical lead in simulation in Dinanath Mangeshkar Hospital, Pune. This is the only hospital which has a simulation center which is focusing on the training of doctors and nurses. Since the last 1 year, this course has been on my to-do list, and finally I'm able to enroll. So I'm really very happy today. My aim for this course is to actually enhance the communication in healthcare at all possible levels, all staff that is involved in healthcare. My name suggests abundance. Vaibhavi is abundance, and hence I think today I'm going to look for abundance in good communication. Thank you.
Thank you so much, Dr. Vaibhavi, for joining the program. So whom do you want to pass the baton next?
I'll pass the baton to Mr. M.A. Hashim.
Yes, Mr. Hashim, please go ahead.
Thank you and good evening. I am M.A. Hashim. I am from Bangladesh. I have been working in a private university as a faculty member from last 10 years. Now the position is assistant professor. As well as I am working in a 150-bed hospital, Bangladesh.
Mr. Hashim, you have muted your device by mistake. Could you please unmute?
Okay,
Yeah.
thank you.
Yeah.
At this moment, I am working in a private hospital and 150-bed hospital.
Wow. So
as a director of laboratory service. So as I feel the medical communication, it's a important issue in our country. That's why beside my teaching, I want to know about medical communication, and that's why I am glad to be enrolled in this program.
Thank you so much.
Thank you.
Thank you. So whom do you want to?
I would like to tell Dr. Mohammad Enamul Haq.
Yes, Dr. Haq, please go ahead. Yeah. Dr. Haq, I think your audio is not connected, so we are not able to hear you. Not yet. Maybe you will have to log out and log in. No, but yes, it is. It's showing that you are connected through audio, but there's some challenge at your device end. Not able to hear you. So would you like to log out and log in once again? So meanwhile, if I may request Shivraj Kumar to introduce.
Good evening, everyone. My name is Shivraj Kumar Tandgi. Currently, I'm working as a clinical education facilitator at Cambridge University Hospitals, United Kingdom. I came here 2 years ago. Before that, I was as a faculty member and head of the department at KL University Institute of Nursing Sciences, Belgaum, Karnataka. So I'm also a certified life skills trainer from NIMANS and certified IELTS master trainer from British Council. So the main reason for joining this program was, though I am a clinical educator, I came here as a registered nurse initially. And I changed my pathway into the clinical education department because I was from education. I see most of the people who come from various countries and start their work here. The basic and important barrier they have is communication. Not only with patients, but the fellow colleagues, and being an English country, you know, the challenges what they face, especially people from India, Pakistan, Bangladesh, Philippines, wherever. I mean, we have people from 89 countries working here. So that's a biggest challenge for us to tackle, because most of the staff who come here, they face the stress with that. So that was the reason for joining this program.
Thank you so much. Yeah, thank you, Shivraj, for joining.
Thank you.
Your objective of joining will be definitely fulfilled. Thank you.
Thank
so
you.
who do you want to speak after you?
I think I'll pass to Sudarshan Joshi, sir.
Yes, sir. Please go ahead.
Hi, good evening all. I am Dr. Sudarshan Joshi. I am a BHMS graduate with Diploma in Hospital Administration and MBA in HR. Currently I'm working as Chief Executive Officer of a 36-bed hospital called Mangal Anand Hospital in Mumbai. Previous to this, I have been working in a medical department in Fortis Hospital, and then I was a facility director in Nova. I was also a cluster head in Cure. It's a hospital chain run by Patni Healthcare. So from last say 8-9 months, I am having an entrepreneurial journey where I have established 2 healthcare companies, and as part of a consulting job, I am heading this hospital as a CEO. My aim in doing this course was from last 13-14 years in my administration career. I have been working with all medical, non-medical departments in the hospital, also working with doctors. Being a passionate operation guy, I feel lots of communicational issues with healthcare workers. As a part of the management team, I have tried arranging trainings from outside. I felt why I should not be the resource person to have in-depth knowledge, and then being the close guy with everybody in the hospital, doctors, housekeeping, nurses. So it would be helpful for me to be a resource person rather than calling, because many a times it is not possible to call from outsiders. So that was my main intention, to be a master trainer and then probably use this knowledge to inculcate or form team in the hospital to train. And actual meaning of my name Sudarshan is probably good darshan, but it's a name of chakra of Lord Vishnu. I would pass on the baton to Dr. Janvi.
Okay, so just a gentle reminder to everyone, please restrict to 1 minute limit, because we want to finish the introduction by 8:30 so that we can start with the session. Gentle reminder, and so that and we'll get a lot of opportunity to interact later on also on number of platforms. And also, Dr. Joshi, the mic on your side is really not functioning well. So there can be a challenge in future you will be answering. It'll be good if you could look after that now. Thank you. So please go ahead. Whom have you nominated? Sorry, Dr. Joshi, whom have you nominated?
Dr. Janvi.
Okay, Dr. Janvi, please go ahead. Yeah.
Good evening, all of you. I'm Dr. Janvi Shah. I'm an anesthesiologist like Dr. Vaibhavi, and currently I'm the medical director at Bhatia Hospital, which is a 200-bedded hospital in South Mumbai. And my name means it's another name for River Ganga. And one thing I would like to share is a lot of people mispronounce and misspell my name. So my spelling is here in against my picture, and it is Janhavi.
Okay.
And it is nice to see you all. So we'll soon interact with each other later.
Wonderful, thank you. But I didn't know that this is the other name of Ganga. This is a new information for me. Thank you, wonderful.
I would like to pass the baton on to Mrs. Rashmi Ambavane.
Yes, ma'am, go ahead. Please unmute your device. It's still on mute mode, ma'am. Your device is still on mute mode. You'll have to unmute.
Okay.
Yes.
Yeah. Can you hear me now?
Yes, we can hear you.
Yeah. Good evening, everyone. Am I the odd one out? I really don't know, because most of you belong to the medical profession or the clinical side, but I'm from the educational background. More of a teacher. Teaching has been my passion.
Mm-hmm.
Turned out batches of students for K-12 schools. And at the moment, I'm working as the inspector of schools for the Delhi board. The very purpose of joining this was to, explore a new area of expertise. And as my name suggests, Rashmi is the rays of the sun that spreads light and energy. I thought of assimilating this great learning experience and creating an impact, on the others. A pleasure being in the midst of such august personalities. Thank you so much.
Thank you, Rashmi. Thank you. Thank you. So whom do you nominate?
I would nominate, I think, most of them whom I see on the screen are already done.
Dr. Ravi is still left.
Okay, Dr.
Yeah.
Ravi. Okay,
Yeah.
Dr. Ravi.
Padma is still there. Yeah.
Yeah. Good evening, everyone, and good evening, Indu ma'am. I am Dr. Ravi Matani. I am an ophthalmologist. I live in Kullu, Manali, Himachal Pradesh. I finished my post-graduation in 88, 89 and worked in Mumbai at Bombay City Eye Institute for 3-4 years. But I was always very keen to, serve in a small town where, I would be more helpful to others. And also, even at that time, the, commercial aspects of medical practice did not appeal to me. So I've been running an ophthalmology clinic here since 1995. And my purpose of joining this course was, over the years, I have seen a lot of change in patients' expectations and, where they no longer, like earlier they used to say, "Ki Dr. Bhagwan hai." It's no longer true. We have to explain ourselves more to them. We have to be complete. And also I would like, how to be succinct, because we have, I have a lot of patient load. So I do sometimes find myself, just rushing them away. So I don't want to do that. So just, to help and serve better. My Ravi means sun, but I don't give much importance to my name, in the sense that, I would just like to be of help and service, and I look forward to learning a lot from all of you. Thank you.
Thank you so much, Dr. Ravi. I think that was so wonderful. So I think Dr. Haq is back. So can we request Dr. Haq to please unmute his device and introduce?
Hello.
Yes.
I think this time you can hear me.
Yes, we can hear you.
Okay. So good evening to you, ma'am, and everybody. My name is Dr. Muhammad Inamul Haq, but I am known by Dr. Nadim. Everyone knows me in my society as Dr. Nadim. I am working as Director of Medical Services in Islami Bank hospitals and foundations. We have 20 hospitals throughout the country. I have joined very recently there as this Director of Medical Services. So my name is Dr. Nadim. That Nadim means friends. So I like to make friends in my institutions and also outside. And I hope with these sessions, I will have many friends with me. So greetings to everyone. And I hope ma'am will teach us so many things that we are missing in our day-to-day life. Thank you very much.
Thank you so much. Thank you so much, Dr. Haq, to have joined the program. From all your busy schedule, you have spared so much of time. I'm really honored with your presence. Thank you. So I think we have Padma still to introduce and Dr. Sherbano. So can I request Dr. Sherbano to introduce and then Padma? I hope everybody is covered. Ryan hasn't yet joined, if I'm not wrong, but he will join in a while. Yeah, Dr. Sherbano, please go.
Hi everyone, good evening. My name is Dr. Shahrbanu Akbarzada. I'm an MD doctor working as an obstetrician and gynecology sonologist in Shifaju Hospital, which is a private hospital in Kabul, Afghanistan. And also I'm working as a technical advisor in Afghanistan Society of Obstetricians and Gynecologists. It's a place of honor for me to joining to this batch, and especially with Indumam. And past batch also I've been learned a lot and a lot from her, because we have a lot of and a huge of communication problems between doctors and patients in Afghanistan, and especially in these situations. And I hope that I can join all of the sessions completely this time, and I can use from the beneficial things that ma'am teaches. Thank you so much, and I'm so glad for being here.
Thank you, Dr. Shah. Honored to have joined the program, especially you said that you are very busy between 7 and 9. So that's the time we are holding the program. Let's
Yes,
see how we can make things better for you and make it possible. But we'll talk about it. I'll talk about it. Thank you so much.
Thank you so much, ma'am.
Thank you. Yes, Padma, please go ahead. Yeah. Please unmute your device. Yeah. We are not able to hear you. No. Maybe you log out and log in, it will be better. Yeah. Sometimes, audio doesn't get connected here. Please log out and log in. So 2 participants are still not there, Dr. J.P. Kapoor and Rehan. So can somebody message Rehan to join? If you could please, and if you allow me, I would like to message Dr. J.P. Kapoor in case it is forgotten or missed the message. Give me 1 second to call.
Ma'am, am I audible now?
Yes, you're audible now.
Yeah. Good evening, all of you. I am Padma Pavani. I'm an MBA graduate from finance. I used to be worked as a financial trainer. Till 2012, I used to be a trainer. I worked as a training manager with different organizations into financial field. I'm certified financial goal planner. Later on, from 2013, I changed my profile into soft skill trainer. Basically, I'm a soft skill trainer. So I'm very passionate in learning. I keep on adding certifications even in my professional, like soft skills as well as financial field. So only to add one more certification and a special knowledge, special stream of communication skills want to learn in this in my profession. I want to add another stream of communication skills. Generally, I deliver communication skill training for different organizations, but healthcare is completely something different compared to other communication skills. So I just want to learn one more skill into my profile. I just want to add. And most of them are coming from medical background. I'm not even a science graduation person, and not from the medical background. I hope you all help me to cope up with the course, because I'm not coming from healthcare background. Thank you very much.
Thank you, Padma. So that's perfectly all right, Padma. I know this is a mixed group, because we need to have people who are actually, part of healthcare. It could be doctors, nurses, administrators, quality professionals, trainers. So it's always good to have a mixed group. Then you will be able to see each other's perspective, and then, learn from each other's experience and use it to your program. So very quickly, I think Dr. Kapoor has joined. Dr. Kapoor, if you may have your camera on, if you're comfortable. And yeah, please unmute your device.
Yes, ma'am, I've joined. Thank you very much for telling me about this. I just forgot it.
No, that's perfectly all right. So you have not missed much. We have just completed the introduction part. I would request you to introduce yourself if you are comfortable. And if you want to take a little time and introduce, even that is all right. So are you comfortable introducing?
I'm perfectly comfortable introducing myself.
A time limit is 1 minute. I must remind you.
No, I just tell you, I'm Dr. J.P. Kapoor. I'm a child specialist working in the Lal Bahadur Shastri Hospital. And my previous engagements have been with many different departments. I've worked as basically as a public health specialist in various departments and worked in the top position as director, family welfare director, health services, additional medical superintendent, school health program head, AIDS control society head. At this moment also, I'm looking after the ART clinic of my hospital as well as Department of Pediatrics. That's a brief introduction. Though I've been part of the soft skills training also in various institutes, and that remains one of my passion to serve the people. So I really want to train people in soft skills also. Thank you very much.
Thank you so much, Dr. Kapoor, to have joined the program. I have known Dr. Kapoor for a couple of years. I think I have visited a couple of hospitals where he has been the medical superintendent, and he was keen to join the program. And I really welcome you, on board. And definitely, see, we learn from each other's experience and the field that we are into. So I think Rehan is left. Once he joins, I'll request him to.
Yes, I'm madam.
Wow, Rehan, if you are there, then please, if you can have your camera on. If you think you cannot have your camera on, you can go ahead. Rehan, go ahead.
But this is Johira from Bangladesh. Actually, Dr. Nadim, he was my CEO. Recently, he left me. Currently, I am working with Epic Healthcare. This is the one and only ISO 151 and accredited lab in Chittagong. So currently, I'm leading the department, corporate business and brand management department. I used to deal with more than 220 corporate clients. So currently, I am dealing with not only corporate clients but also the different GM, DGM, CEO, HR head. So these types of people. So to understand better communication, healthcare communication, to understand, I am currently enrolled this course. And this is also advised by my current boss, Dr. Saifuddin Khaled.
Thank you. Dr. Saifuddin himself has attended the program, so he's really recommending to a lot of people in
yes,
this country. And I'm very thankful to him, convey my regards to him to have recommended this program to so many of you. Thank you. And I'm sure you will be happy to have him here. So let me quickly give you the overview of the program and why am I calling it Master Trainer Program, and then we go ahead with the topic. So the whole idea of naming it as a Master Trainer Program in healthcare communication, because I am not just going to focus on the communication topics or content. Content you can get anywhere. But ultimately, to become a trainer, you really need to have those qualities of a trainer, where you learn how to go about developing a program, how to deliver a program, how to facilitate a program, especially when you are dealing with professionals like doctors, nurses, and paramedical staff. So you really need to go down to their level and see how you can make your program suitable to their training requirement and their understanding and up to their expectation. So the whole program has been designed in a manner where we are going to definitely talk about what healthcare communication is, because I can see some of you are not familiar with what healthcare communication is. But don't be scared. Trust me, even people who are in healthcare, even they do not know what comes in healthcare communication, because mostly people think healthcare communication is all about niceties, being nice, being good, soft skill training, but that's not true. So I sent you a list of topics. If you had a chance to look at the topics, we are going to cover 10 topics. So the first 2 topics are going to be very basic. One is what is the introduction to healthcare communication, and how is this program different from any other soft skill training. That one part we are going to cover. The second topic will be developing communication competencies, where we are going to talk about the basics of communication, including verbal and non-verbal communication. These 2 topics have been planted with the idea so that all of us are on the same page when we start from there. See, because I know some of you are from healthcare, some of you are from training, some of you are from quality, and some have just no idea about what it is all about. The next 2 topics will be on how do you design a successful program. As I said earlier also, a lot of us have wonderful knowledge, but when it comes to delivering, we don't know how to go about conducting a program and how to pitch your program. How do you really, land into that you get the opportunity to give your program. So one session will be on how do you go about designing a program. So we'll be talking about the finer details of what makes a successful program. Session 4 will be on facilitation skills. The idea of having facilitation skill is most of us are used to using PowerPoint presentation. So fortunately, I had the luck of attending a 3-day crash course program by Dale Carnegie. And the trainer that we had in that program, 3 days from morning 9 o'clock till evening 6 o'clock, we were around 30-35 participants. It was in Lemon Tree, Gurgaon. He did not use even a single slide, not even a single slide. And he ran the program so well that I was actually, completely, flattered by the way he had delivered the program. So facilitation skill is what pedagogy should I choose to make my program interesting, engaging. As I said, I cannot teach you anything. You all are already so well learned, but I can give you some food for thought. I can give you some ideas, which you will try to, when you will try to experiment, you will find them useful. So we are going to spend a lot of good time on understanding what are the different pedagogies available. Like, for example, storytelling, using puzzle, using videos, using interaction, group discussion, and whatnot. And not depend on just PPT. So session 4 will be on what are the facilitation skills that can help you run a beautifully successful program. And then session 5 onwards, we will be covering all the topics related to healthcare communication. For example, understanding patients' expectations or handling aggressive patient party, delivering bad news. For example, if you have to tell a patient that you have cancer or you cannot conceive or you have a stillbirth or whatever. So how do you go about doing it? Then disclosure of medical error, where, for example, something has gone wrong and unfortunately it's one of our staff member who has kind of done that error. So again, the effort is usually to hide it, but you can't hide a lot of it because ultimately it comes out. So how do you go about, disclosing the medical error? What is the protocol? What is the right way of doing? We are going to talk about that. And a lot of other topics that are going to be covered from session 5 to session 10. From session 5 onwards, the duration of the session will be 2.5 hours. And the reason for that is because 2 of you will be making presentations in each session. And the presentation will be on the pedagogy that you will choose to present. For example, I'll be giving you a list of pedagogies. Each one of you will be writing your name in front of that pedagogy that, okay, I will be talking about storytelling, I'll be talking about puzzle, I'll be talking about some ice-breaking activity, and there's a list of that. So in each session, after I finish my session, last 30 minutes will be given to 2 participants or maybe 3 participants, and 10 minutes each one of you will present. And you will be talking about what that pedagogy is, what are the do's and don'ts, how do you go about using it, where all it will be useful to use this pedagogy. I'll be there to help you. You will be discussing with me before you make the presentation so that you know what you have to talk. And then in 10 minutes, you'll be giving an overview of the pedagogy. So that means we will be learning around 15 different new ways of delivering a successful program in that session. And of course, group discussion is going to be the most interesting part because you'll be bringing in your experience and expertise to the session. So this is in a nutshell about the program. Now, if I may ask you, are you okay with the topics that I have shared with you, or you want to change a topic, or you want some topic to be replaced? I hope all of you had a chance to look at the list of topics. Are you all okay with that?
Yeah, okay from my side.
Wonderful, wonderful. So this is what we have found, that these topics have been, liked by all the participants that who have attended the program. But in case in between, if there is any topic that you think you really want to be covered, we'll see how we can fit in that topic. So before I go further, I want to give you a form which is about to see before we start the session, where do we stand? It's more like pre-program assessment kind of a thing. So let me quickly share the link for that form. Give me 1 second. to copy paste the link. Okay, I'm sharing the link in the chat box. So I will request everyone to fill in that form before we move further. Yeah, I've shared the link. Please check if it is working.
Ma'am, have to fill now itself or
Yes,
later,
yes.
later on?
No, before we start the session. Yeah, now.
Okay.
So do you want me to share it in the WhatsApp group also?
Not required.
That would be better, ma'am, on WhatsApp.
I have shared. I've shared in the WhatsApp group also. So once you have completed the form, please write done in the chat box so that I know everybody has done it. Yeah.
Ma'am, certain questions are completely related to healthcare.
That's okay. You can, can you tell me the question that you are asking about?
Generally, how certain are you that you are able to successfully identify the root cause of a patient dissatisfaction and address it amicably through training or skill building? These are all.
Okay, so if you think you haven't done it and you have no idea about it, you can write that I'm uncertain or extremely uncertain. Whatever answer suits you. Yeah. That means it's altogether a new learning for you.
Most of the questions are related to patient only, ma'am. Patient handling skills.
Yeah, yeah.
Shall I mark uncertain for everything?
Absolutely. If you are not sure, if you are not
because it is not.
Yes, you can write no. It's all right. It's all right. Perfectly all right.
Ma'am, I think in the 10th question there is a problem. Like,
yeah.
That for whom all are comfortable taking programs, training programs.
So you can tick all.
But then I think there's an error coming over there. Must select at most 0 options.
Oh,
I'm not sure.
Let me change the setting one second. So is it changed now or no?
I'll just check, ma'am.
Yeah, please check once again. Yeah.
No, ma'am, it's again coming that must select at most 0 options.
So maybe you can leave it because maybe there's some change in the setting.
Because if we don't answer that, ma'am, the form does not get submitted.
Okay. So are you able to click on anything?
Yeah, ma'am, I am able to click on all, but
Okay.
then it's still not going up.
It's still not
Sorry,
accepting.
ma'am, but I have the same problem also.
You're
Phone
not
is
able
not submitting and it's writing, yeah, it's writing you must select at least 0 options. After selecting
We are not
all
able to
options
submit
also.
the form.
I get that. 1 second, let me try to change the setting for that particular question. Try now. Are you able to submit now?
No, ma'am.
No, in case if you are not giving any answer, still you are not able to submit?
No, ma'am.
No, ma'am.
There is one question, which is question number 10.
Okay.
Which is the one which says must select at least 0 options. So I think that is the one probably hindering the.
But I can see somebody has responded just now. I can see one response. Dr. Janvi has been able to submit her response.
Yes, ma'am. You have to just refresh the Google form again and
Okay.
you can do the last one.
Okay.
Yeah, please refresh. Yeah.
Okay.
Yeah, now
Yeah, ma'am, done.
Yeah, now I could see.
It's done, ma'am.
Yeah. So I can see 6, 7 responses. I'll wait for another 1 minute. So if you could raise your hand and tell me who all are still doing, it will be easy for me to count.
Ma'am,
Yeah, Padma, tell me.
when I'm clicking submit, it's not submitting.
Is it?
Yes.
I can see 8 responses. So have you refreshed the form and then?
Okay, we'll refresh once.
Yeah. Okay. So by the time others complete.
Now it's submit. It
Okay.
was submitted now.
Thank you. Thank you. So if I may ask you, how is this clinical communication or healthcare communication different from our day-to-day communication? Or how is it similar? In what ways is it similar and in what ways it is different?
Ma'am, shall I?
Okay, go ahead, please.
General communication is, there is no negative or any anxiety is not in the people. It's a generalized. But in healthcare communication, one part of a communication means it's between two people. At always one party is in hurry, anxiety, stress. Healthcare means.
Thank you. I understand. I'm getting your point. Anybody else who would like to say? Yes, Dr. Ravi, please go ahead. Yeah.
Ma'am, in the difference in healthcare communication, I feel is that the respondent, who is the patient, or has a lot of expectation from us. So we have to be very careful and complete in what we are saying.
Absolutely.
We cannot be casual, and we have to be very serious about the matter.
Now,
That's
how
the
do
main
I go
thing
to
I feel.
this?
Absolutely. So I can see a response in the chat box also, and if somebody wants to write in the chat box, you are more than welcome to write. So Dr. Sharban has written this different because you have to do so much careful healthcare communication, as it can lead people to die or save them from suicide, give hope, make a life a day and hope. Absolutely. So you are dealing with patients, you are dealing with people who are sick, people who are suffering. So it may appear to be a day-to-day communication, but it is actually not a day-to-day communication. Yes, Padma, I agree. It is a very sensitive communication. I agree, because you are dealing with human beings who are unwell, who are sick, who are in need. Like Dr. Ravi said, that they have expectations. So they have come for a service. So when we become a service provider, then it becomes a very different kind of a communication. Dr. Farah said, we also need to take care of ethics. Absolutely. So that means it cannot be a casual talk between two friends or two acquaintances. Dr. Webby says patient safety centric communication between staff and also patients, I would say, patient and their family member. Absolutely right. So although the communication between us and the patient look like regular communication, but you all are very right that because we are providing a service, so we become accountable, we become answerable for what we are doing. Plus, in patient care, communication can cost us a life, like Dr. Sherbano said. We can make an error and kill a patient because of wrong communication. So it's not a day-to-day communication. Plus, the patient who come, they are suffering, they are in need of attention, care, communication. If we don't meet that need, even if we have been able to give them medical care, they are not satisfied. They go back unhappy. Now, if I may ask one more question, I don't think we ever talked about clinical communication or health communication program for anybody like us, maybe 10, 15 or 20 years ago. What has changed? What has changed in the last, couple of years? Yes, Dr. Janvi, go ahead. Yeah.
I think one of the things which I have encountered is even the health literacy of the people have gone up. So, they have become more open towards understanding. They are more knowledgeable.
Absolutely.
And they want to know more about their disease. So, all the more we need to be
I
careful.
completely agree with you. Patients are now more aware. Patients are educated. Patients have access to Google. Absolutely. So Dr. Webby says, yes, expectations have changed. Yes, education of patient has changed. Dr. Sudarshan says healthcare has become a service industry. Yes, because we are now charging the patient. So you have to provide service. You have to give them value for service. And also there are more options in treatment. So hence a choice, and they need to be, Dr. Nair, you have raised your hand, so I think you wish to make a point. Please go ahead. Yeah.
Ma'am, just continuing with the point which Dr. Janvi had just spoken about, is that now the clientele which is coming, even though I don't like the term clientele for patients, because patients are after all people who are coming over to the healthcare setup for their specific problem. But the issue is now with the Google with Googling of the symptoms and people becoming more aware of that leads to, and with poor communication between the healthcare provider and the patient, that creates a problem. Adds on, and then now with commercialization of our medical facilities and with consumer protection, so the communication plays a very, very important role. If there's a negative communication or there's a break in communication between the healthcare provider and the patient, invariably that particular case will end up, or invariably will end up in some sort of a problem.
Absolutely.
So that I think
absolutely
that's one.
So as long as we were not charging the patient, we were considered gods because we were giving something free. Or even if we were charging, if it was a nominal charge which was okay for the patient, even then patient treated us and healthcare professionals as God, because you are almost giving your education and your knowledge for free. Today we are charging the patient. Today patient is paying for the service, and it's not small amount. It's quite huge. So therefore they expect the value for their money. And as very rightly said by Dr. Nair and Dr. Webby, that they have access to information, they can Google search, they are well read, they are educated. So definitely you can see there's a lot of change in the expectations of patients, and we have to meet that expectation. I think Shivraj, you want to say something? Go ahead, please. And after that, Dr. JP Kapoor. Go ahead, please.
Yeah. In addition to what the doctors have said,
yeah,
the clinical communication has impact on the time factor what we give for the patient, I think. Because I'm doing a systematic review on a topic like the communication pattern and time frame between a doctor and a patient or a nurse and a patient.
Absolutely.
It's hardly, I found some articles from India that hardly, it's like when a patient comes for a consultation, it's hardly 3 to 4 minutes or 5 minutes. A communication happens between doctor and the patient.
Absolutely.
I think which is impacting more.
Absolutely. I think that's another part that you have brought in here, that we are not communicating enough. Earlier, patient never mind. They never had any expectation that doctor should talk to me, answer me, explain me. But today they expect us to talk to them and explain them and engage them. So the time that we are giving is absolutely not enough. We are going to talk about that. Yes, Dr. Kapoor, you have raised your hand. Can I request you to keep your camera on, Dr. Kapoor, if that's okay? Because that's what I have requested, that everybody will have their camera on so that we can see each other. Otherwise, I can miss on you. Go ahead, please.
Sorry for that. I'm sorry for that.
Your voice is, no, Dr. Kapoor, we are not able to hear you.
Am I clear now? I'll come closer. Is it okay?
Slightly better, but really not very good.
Okay.
Yeah.
Shall I come more closer? I was just talking about the two issues. You raised the issue of charging. I'm working in a government hospital.
Yeah.
And there also we don't charge anything, but the expectations of the patients from us is there equally when the patient is being charged. Other, they are similarly acting us to talk to them. I always say to that, the thing is, it's just not literacy. There the patients may not be literate, but look at the environment around which have been created for their sport. At this moment, they can call the media people at a click of a button. And each one of them is having a mobile phone with them and they start clicking.
They can record it. Yeah, they can record.
The way you are talking to them. Not only that, legal issues, news items, everything says that at this moment, only one thing which can help us out in this difficult situation is our communication part.
Absolutely.
It's a very important point which we are talking about today, which is there. The other thing which Dr. Shiv Kumar was talking about it is, I have a study which I always quote, that it just take 30 to 45 seconds more to develop it as an art of communicating, spending 45 seconds more of talk, and you will be able to satisfy your patients by your talk only.
Absolutely. Thank you so much. Yeah, thank you. So Dr. Ravi Matani has written in the chat box that many treatments do not have an optimal response. So patient confidence and awareness about therapy is very important. Absolutely, Dr. Matani, I agree with you. A lot of treatment protocols do not have the outcome as per the patient's expectations. So we got to be really careful when we are giving them the expectation or when we are promising them something. We got to be really careful that we do not overpromise them. And also, in case if there's a risk, there's a disadvantage, there's an after treatment error or after treatment problem, all that has to be informed so that the patient can take an informed decision. The whole concept of informed decision is still missing in our culture. We only share the information that we think we should be telling. Rest of the things we hide because we know we are the source of information and the patient will never get to know. But yes, now things are changing and we got to address that. We are going to talk about it. Yes, Dr.
I want to add something.
Yeah, go ahead, please. Yeah.
As we have to, for safeguarding us, we need to deliver the patients about the interpretations that we're giving the results on. And some things like when working with quality things in the diagnostics, we have to teach them, actually make them knowledgeable about how we work and how we are giving our results so they can rely on it. And that is also will safeguard us.
Absolutely.
Yes.
Absolutely. So if you have informed the patient that this particular treatment protocol has only this percentage of success rate or these are the associated problem, then your legal, ethical, moral, and medical responsibility is well done.
We will be very much confident that what we are giving, what we are saying is you can rely on it.
Absolutely.
So they will also understand, and it will be a
wonderful. I think that's the art we have to really learn, where we are able to talk about this in a very confident and honest manner, transparent manner. And if you say about something, if the patient even goes away, and asks the other doctor, definitely the doctor will have to answer, yes, this is one of the possible complications or risk involved. I think that's the beauty of this communication. Dr. Webivi, you said social media is a weapon. Yes, I agree. People are using social media to our disadvantage. And also, we do not know how do you go about using social media to your advantage. We lack that skill. I do a program, I'm not right now, but I did around 10, 15 programs with IIM Ahmedabad. So this was being organized by another body. It was practice and reputation management for doctors. Very senior level, consultant level doctors were attending that program. And I was also delivering certain topics in that. And one of the topic was using social media with care. We don't know how to handle social media people. We don't know how to handle bureaucrats. We don't know how to handle politicians because this is never taught, because this was never required. Nobody ever harmed us. But today, if they are there to harm us, I have to learn, how do I protect myself? How do I take, I won't say the word advantage, but how do I manage that in a manner that it doesn't go against me? So social media is a double-edged sword. I completely agree with you and have to learn it. Yeah, Rehan says most of the corporate patients don't want to follow the rules. They used to demand service immediately. Yes, because most of us are used to instant gratification. There was a time we used to write a letter. The letter would reach in 3 days. Then the person will reply to that letter, and we will get the letter after that person posts in another 3 days. So we knew if I have asked something, my response will come in 6 days or 7 days time. Today, when we write an email, we want, any idea what is the expectation for the response for the email? And what is the optimum time? 3 hours.
Nowadays it is, yeah.
Yeah.
Yes,
and if you write a WhatsApp message, you will keep looking at it, padha ki nahi padha, blue tick hua ki nahi hua, because we have all become used to instant gratification. So it's not just the patient, even we want things at the click of button, and that's why the whole environment has become so hyped. I agree with you. Then please let us know when you hold the practice reputation management program. Okay, Dr. Matani, thank you. We'll do that. Yes, within no seconds they expect the answer. I absolutely agree. Dr. Vaibhavi has written, the primary role of a physician is to educate a patient rather than to only treat. Yes, I think that is one thing that we have to now learn and get used to. I always say, you were a decision maker a couple of decades ago. Now you are not a decision maker, you are a facilitator of a decision making. Empower your patient to take a decision sensibly. And let me tell you, the beauty is you are benefited by this change. The onus does not completely now fall on you. Otherwise, you were held responsible for taking a right or a wrong decision. Now, patient and the family cannot say that I was not told. But we have to do it in a very appropriate manner, not like an eye wash. So I was recently assessing an eye hospital for upgrading that hospital for certain services, and the counseling part that they were doing was so limited to the financial counseling that I had actually a doubt about what this counseling is all about. Even consent taking was being done by nurses and by technicians and other support staff, and not by the doctor. And we know legally the consent form has to be, consent has to be taken by the doctor after explaining what we are going to do, how we are going to do, what is the risk involved, what are the complications. So we can't deny this now. Let me share the presentation with you, and one slide that I want to immediately show you why things have become different and changed, and why now things are, we really need to upgrade our communication skills, because practice of medicine was far more simpler and easier. Patient had blind faith. I will not say whom do we blame for the loss of that faith, but there are multiple factors that have changed the trend in healthcare. For example, as you said, people have become more aware, their expectations have gone up. Answerability, our answerability has gone up. Aggression and stress among everybody is high, not just the patient, even among doctors, healthcare providers. Very rightly said by you, media participation is increased. People have phone, they record your video, they put it on social media. They don't even give it to the any media house. They just post on the media, social media, Facebook, Instagram, and your job is done. So we really need to be careful. How do we protect ourselves? Litigation, yes, I think, are we really now concerned about litigation? Does that bother us? Yes, it bothers us now. We never thought that we could be litigated, but now we all know that there's always a risk. The patient can call media, patient can call police, patient can go to the court and file a case against them. Extent of fights. I think this is something further, worrying us. I was taking a session for a set of medical superintendents in Delhi Secretariat, and one of the medical superintendents, he shared his experience that in his hospital, a resident, had an argument with the patient's attendant in the casualty. I mean, they were about to physically start fighting. There were people, they stopped and controlled the situation. Everybody thought it is over now. Unfortunately, when the resident was going out of the hospital, the family of that patient was standing outside. They literally physically thrashed him so badly that he had almost like 20 fractures in the body. Imagine the extent of the kind of fights we used to have. Simple argument. At the most, people will raise your voice. But today, we can see things going completely out of hand. I think this is something really worrisome. And for this reason, I think we really need to see how can we protect ourselves and prevent violence in our workplace, because that's something which is worrying everyone. All these changes bring us to a point where we need to literally introspect. Am I communicating enough? Am I behaving well with my patient? Am I treating my patient with respect, with care, with the patient's concern? What do studies suggest? Unfortunately, studies, not only in India, but even in the other developed countries, suggest very different from what we are doing. Studies suggest that, it's a study by Institute of Medicine. They studied that the patient-provider communication is often inadequate because we lack adequate communication skill training. We all know that most of you have learned your communication, behavioral and interpersonal skills by observing your seniors, observing your teachers, observing your professors. There was no formal training as of now. Recently, Medical Council has introduced ADCOM module. I'm sure most of you will be knowing for the medical students. So they are trying to inculcate attitude, ethics, and communication right from year one. But you can well guess after how many years will we really have graduates who will be actually aware of the communication and interpersonal skills required in patient handling. Another study in which 75% of the orthopedic surgeons said that we believe that we communicate effectively, whereas only 21% of their patients agreed to the idea that yes, my surgeon does communicate effectively. Imagine the gap. Most of us think that we communicate very well, but ultimately the communication is received by somebody. Is that person satisfied? Is that person, actually getting the communication? That's a bone of contention. Any idea in how much time do we interrupt the patient when the patient starts talking? Any guess? Any guess? 1 minute, 2 minutes, 3 minutes?
30 to 40 seconds.
Quite close, I would say. 11 seconds. Imagine the patient has waited outside your room for maybe 1 hour or 2 hours, if it's a government setup. Even in private setup, half an hour, 45 minutes is a very regular, time they will wait for you. After waiting for that much time, when they come to your room and they start talking about their problem, we interrupt the patient within 11 seconds. Do you think patient will be satisfied if we interrupt the patient and we don't allow them to speak? We normally think that if we allow the patient to talk, they're going to take a lot of time. So therefore, we start asking closed-ended questions, or we start asking leading questions to immediately get the information to make the diagnosis and start with the treatment. Any idea, if you allow your patient to speak, in how much time can they talk about their problem? Guess?
5 to 7 minutes.
How many minutes?
5 to 7.
5 to 7 minutes. On an average, a patient can talk about their problem in 80 seconds. I know you must be remembering those patients who talk a lot. 70% of the patients would talk to the point. 15% of the patients are such who would have to be actually forced to talk. If you go to them, if they come to you, they will not say anything. And when you ask what is it that you're here for, they'll say, "Aap dekhiye, aap check karo." 15% of the patients are such who will have to be actually stopped, that please be quiet so that I can ask you some questions. But 70% of patients are able to talk about their problem in every 80 seconds. And if you allow patients to speak for these 80 seconds, their satisfaction multiplies many fold. And that's the thing that we have to remember. I'm going to show you a paragraph. Please read the following paragraph carefully. What did you understand?
Nothing.
This is exactly what happens when you explain to your patient about their diagnosis, treatment, prognosis, or anything about their treatment, because we use a lot of technical jargons. How many of us ask our patient, okay, I've explained you about your condition. Can you tell me what have you understood? Can you tell me in your words, what exactly have I explained you about your treatment? Trust me, if you will ask your patients, they will not be able to talk about or mention about more than 20 to 30% of what you have told them. Because most of the times they will be listening to you and nodding, but actually they have not understood. Studies suggest half of the families do not understand anything when you talk to them about the patient's diagnosis, process, or treatment, because they have not understood, but they will not ever say it. Studies also suggest that our communication does not meet the basic standards of informed decision making. So when you are taking consent, that means I have informed you everything about the procedure, and now you're agreeing for the treatment. That's the message when the patient signs consent. Most of us do not do it. And I remember around 15, 20 years ago, it used to be the nurses who would take the consent. Normally doctors would say, sister, uska consent le lena. Sister, usse sign karwa lena, and that's all. And patient would quietly sign. But today, legally also, we are supposed to be explaining everything to the patient and then taking the consent after the patient agrees. Now, some clinicians feel that shared decision making is not appropriate in every situation, because we think if we will share all the information, patient will run away, patient will get scared, patient will not agree for the treatment. But in contrast, there are those who advocate shared decision making is suitable in almost every situation. So what I say here, that shared decision making is more like a sandwich approach, where one layer of facts and figure, where you need to tell what are the possible complications or the risk involved in case if this patient has this, can't say that you haven't explained to me. So one layer of facts and figure, and second layer of assurance and reassurance. So there will be multiple layers of facts and figures and assurance. For example, yes, there is a possibility of this risk. But then when you say, don't worry, we have a team of doctors who are there to manage. We have all the equipments to make sure that we can manage the situation. So what you are saying, yes, book says that this is one of the risks, and then we say this is the remedy I have, or this is the facility I have to look after that. But studies suggest that we do not actually genuinely practice informed decision making. So this was a recent study done by Teragini, and I found their findings very interesting and useful. In this, 45% of the patients and their families reported that it was more like a rushed consultation. They expressed inadequate clarity on diagnosis, lack of clarity on the treatment and care options, They also perceived that they were not involved in deciding the treatment. So they felt that somebody else is deciding on my behalf, and I'm not given the free will or autonomy to choose whether I want the treatment or not, or when do I want the treatment, and how do I want the treatment. And most of them said that they felt unempowered in the treatment of their patients. The same study also says that 32% of the patients and their families indicated that the attending doctor did not straight away address their questions and doubts. Especially, for example, if the patient is asking about the financial implications or post-procedure care or expenditure or duration of stay, number of follow-ups, or second opinion, these are the things we are not very comfortable with. As a result, most of the patients, like 32% of the patients, felt that their questions were not answered and they were not involved. This is what is the situation. Now, if I may ask you, if we communicate effectively, how do you think that will benefit the patient? We'll choose one by one. First of all, let's understand how will patients be benefited. Please write in the chat box. How will the patient be benefited if you communicate effectively? Yeah, ability to gain confidence and acceptance, absolutely. They can make their own decisions, yes, absolutely. They'll be happy that you allowed them to take their decisions. Patients can make decisions, yes, Dr. Janvi, I agree. Will be able to take proper decisions, yes. And not just, I'm not talking about just decision making. I'm saying if you communicate effectively, how will that help patient? Not just decision making, in general, for example, even basic courtesies, if you offer them, how will that help patient? Patient will be relaxed and happy. Yes, I agree. Yes, Dr. Farha. So patients know everything clearly about situation and treatment, so he or she can take the course of treatment completely without mistaking. Yes, definitely, patient compliance will be better. It will help you earn their trust. Yes, satisfaction will come back, compliance, and will also compliance. Absolutely. Patient will be satisfied. Yes, Padma, you're right. Stress reduction. Yes, Dr. Haq, I agree. When you communicate effectively, their stress level goes down. This has been scientifically studied. It will allay their anxiety. Yes, Dr. Janvi, I agree. They are assured that they will be well taken care of. Absolutely. Patients feel comfortable with us. Definitely. And it's not just the psychological part that we are talking here. Let me show. Yeah, Dr. Rajesh has written overall confidence on healthcare delivery. I absolutely agree. So therefore, it's very important and essential to get back the respect that we had in their eyes so that we are not victim of the situation. Now, let me show you a couple of studies that have actually shown if you communicate effectively with the patient, it helps them recover faster. It improves their recovery. For example, there is this study that says that if you communicate effectively with your patients, they have a better control, pain control, and there's improved response to the pain management modalities. Number of studies have shown this, that if you have good communication with your patient, they will have a better pain control. And also the modalities that we will use, that will have a more impact or will be more useful. Also, another couple of studies suggest that even chronic conditions like diabetes, high cholesterol, hypertension, HIV, you will have a better control and effective management of these conditions. Because these conditions are going to be almost like lifelong. If you are able to educate your patient well, answer their questions, explain them the benefits of compliance, follow-up, regular treatment, automatically they'll be able to manage their condition. I don't know how many of us really talk to these patients about their lifestyle changes or about exercising or about appropriate diet. We normally focus on writing medicines, which is okay, which is required. But a lot of communication is about their lifestyle change. A lot of communication is about their dietary changes. A lot of time, focus is on stress management. And all this, I know we all know that this is related to our physical and mental health. And studies suggest that if you are able to develop that rapport with your patient and empathy, they will have a better control on their problem. Also, even in cardiac surgeries, they have been able to see improved outcome after cardiac surgery and decrease in post-operative complications such as cardiac arrhythmias, in cases where the patient had good communication with their doctors, the treating team. Now, that was about the patient. Now, if I may ask you, how do you think effective communication will benefit you? How will it help you? Write in the chat box. Yes, Dr. Vaibhavi, I agree. Your Hippocratic oath will be fulfilled. I absolutely agree with you. Yes. Overall confidence in the delivery will be increased. Happier patient, happier. Yes, if the patient is happy, you are going to be happy. You are definitely going to be happy. So I'll know more about the patient. Doctor or hospital is not asked the same question again. Okay. So Dr. Joshi, you have written doctor or hospital is not asked the same questions again and again. Can you explain what exactly you want to say through this question?
If the communication is not proper, then they keep on coming back and asking you, is it right, is it wrong?
Absolutely.
They find, because of today's education through all social media and Google, they try to poke and see where we make mistakes.
Absolutely.
So if you are clear and properly explain them, then those things will reduce.
They are satisfied and they'll have trust in you. Absolutely. So, Padma says you can avoid further issues. Dr. Haq says it will help us to find our area of improvement. Yes, trust will be built. Yes, Padma, I agree with you. Expectations and reality will be fulfilled. Yes, Shivrajan, I agree with you. Zahir says both side satisfaction. Yes, patient satisfaction and professional satisfaction, and both are important. And doctor will be able to make good decisions of treatment plan, and journey will be smooth. Absolutely. And that's very important. You are dealing 20-30 patients every day. Have you ever calculated how many patients are you going to see in all your life? Have you ever calculated? If you are saying 20-30 patients every day, in a month you're going to see at least 1,000 patients. In a year, almost like 10,000 patients. Even if I consider your practice span as 30 years, so anything from 3 lakh to 5 lakh or 10 lakh, depending upon where you are. If you're in government setup, you will see almost like 70-80 patients every day. And that many opportunities of stress. And if you have good rapport with your patient, you can actually stay relaxed and calm. Absolutely. So more patients and good income. Yes, Dr. Sharbano, I agree with you. There's a direct link between how your patient goes and how much. Any idea what percentage of patient comes through word of mouth? Any idea? Unmute your device, Dr. Matani. You were saying something.
100%, ma'am. No publicity helps.
Absolutely. But studies suggest 75% of your patients come because of the good word of mouth that your patients spread. You don't have to invest in any advertisement. Your patients will send you more patients. So I think we are all on the same page. There are no legal issues, Dr. Kapoor says, and patients don't, I will know more about the patient. Doctor-patient relationship will be healthy. So that means it is not just for the patient we need to communicate. For us also, see, we spend almost 6 to 8 hours, rather more than that, around 10 hours in our workplace. मैं हमेशा कहती हूँ, we go home just to have food and do our other responsibilities. Most of our productive time we are spending in our workplace. And it's very important to create a healthy, peaceful, cheerful work environment. If you are experiencing stress in your workplace, one, imagine in 30 years how much of stress you are going to accumulate. And second, every day when you will go home, you are not going to remove your apron and stress and leave in the office. You're going to take that home with you and transfer it to your family, to your kids, to your spouses, to your other family members. Therefore, it is very important to make sure that we don't, transfer that stress to our family and our other, other members. So if you are able to communicate effectively with your patients, studies suggest that patient compliance will improve. Because if you have explained well to your patient what treatment they have to take, for how long they have to take, what medicines are essential, what they cannot, stop, or if they need to change, they need to come back and talk to you. So if you have explained them well, you will see your patient's compliance will also be improved. Studies show this, that you can improve your patient's compliance, and overall universal compliance rate is almost like 30-35%. But that can be only improved and earned if you communicate effectively with your patient. Even the perception of care, idea about the care also changes if you have communicated effectively. So I say always the 3 factors that decide the success of your practices, and that is A, B, and C. Can anybody guess what is this A, B, and C? Can anybody guess? Right in the chat box? A, B, C. Success of your setup or your of your organization depends on 3 things, very basic.
Availability, behavior,
Okay.
communication.
Very good, quite close. Thank you. Thank you. Anybody else who would like to try? So A is ambience. Ambience of your place has to be, if not 5-star, it should be good. Clean, aesthetic, ventilated, well kept, especially your toilets, waiting area, that all should be clean and welcoming. So ambience of your place has to be good. People value that. People don't like to go to a place which is lower than their standard. So you have to maintain a standard. That's A. C is your competency. If you are a doctor, you are a nurse, you are a technician, you are a quality personnel, your competency will take you places. If you want to be successful, you have to make sure whatever you do in the best possible. B is your behavior. Behavior of everyone. So you can see everything is around A, B, and C. Even safety and continuity of care comes under C. Now, in case if I give equal importance to 3 things, that is A, B, and C, 33%, 33%, 33%. Our average clinic with average competency, average, I'm not saying below average, but average competency, but with good behavior, you will see doing better or equally well to those who have good ambience, average behavior, and best competence. Because patients value behavior. Patients do not care for your degree, they care how you handle. So you have to make sure that even, for example, if you will be short of any service, for example, the patient has come and your machine is not working, or your doctor is not there, or you have to postpone this surgery. But if you will be able to sit and talk to your patient and explain them well why you are postponing, or why and you apologize for the inconvenience, patient will still say, it's all right, I'll come back. On the contrary, if I'm not, even if I'm giving best of the service, but I'm rude with my patient, or I'm not courteous, they feel bad. They make a mental note of it. And when they get angry or aggressive, it's not one person who has misbehaved. It is the whole team that has misbehaved with this patient. So at the end, they become, their patience goes out of control, and they become aggressive and violent. So the perception of care is also dependent on the way we connect with them. So compassionate, connected care actually improves the perception of care. Patients would have a lot of questions. They want to understand about their condition. They may want to understand the outcome. When you are able to answer those questions, when you listen to them attentively, when you address their concern, all that leads to greater patient satisfaction, and they go back happy. If I may ask you a question, in a simple activity like any blood investigation, say blood count for a patient admitted in a hospital, any idea in how many how many people get involved in that activity of collecting a blood sample and getting the report? Can you count? Okay, 5, 7, 8, 4, okay, 6, 5, 5. So we have people from diagnostic labs, so they can tell us better. But I'm talking about the indoor, yeah, 6 to 7. So that means, imagine for a simple activity like blood collection and getting the report, 6 to 7 people are involved, and that many opportunities of error. That many opportunities of error. I was taking a session for a group of nurses. So one of the nurse, she shared her, an incident in her hospital. She said, "मैं एक patient का sample लेना था, मैंने staff को बोला, go and collect blood sample from patient on bed number 6." She went and got the blood sample. We sent the blood sample. The report came in. So next day, when they were, it was a consultants round, and they were discussing, at the bedside of the patient, they were discussing about the reports that had come. This patient says, I don't think my sample was collected. I don't know whose report it is. So everybody got surprised. How can it be? There are reports, and you're saying that my sample was not collected. So when they went into detail, they found out that patient of bed number 7 was sitting on bed number 6. And the student who had gone to take blood sample, she did not confirm the name. She did not check for whom I have to take the blood sample. She took the blood sample and she sent it for testing. This is one example. And I'm sure we have people from the diagnostics. So if I may ask them, what are the common errors that happen in the diagnostic lab? So we'll have more ideas of the kind of error that can happen. What do people say?
Yes, ma'am.
Yeah.
One of the main problems is with identification error. Just now that you have given an example, then we have error in like transcription error. We are putting that data in the software, and when we are doing that, we are making mistakes, and that may cause a problem. Then when we are receiving that sample in the laboratory, then if you do not check the names with the software and the hard copy, then there may be error, identification error. Then the sample is processed. Then you are putting barcode. If you are not putting the right barcode on the right tube, then there will be error. So in every step, there is a chance of error.
Excellent. So, and I can see some more responses coming from Rehan and Dr. Haq. So, yes, identification error, transcription error, wrong report handout. Yes, very common. The pre-analytic errors that we have seen. So during my residency, a patient scheduled for renal stone surgery had his cataract removed. Oh my goodness. Identification error. Absolutely. Absolutely. And these are the things that are happening right under your nose. Only thing is, if the patient does not get to know, nobody gets to know. But if the patient gets to know, that everybody gets to know. Now imagine for a simple blood investigation, if there are possibilities of that many number of errors, imagine if the patient is admitted for 3 to 4 days. Any idea in among how many people the patient's information gets, it moves, exchanges hands? Any idea? Can you guess? If a patient is admitted for 3 to 4 days, how many people handle that patient's information? 50 to 60 hands. And that many opportunities of error. That many opportunities of error. And if we communicate effectively, documentation is also communication. Adding information to the patient's file. Okay, Padma, your device was on. I've muted you. That's okay. That's okay. I know we are at home, so it's possible. It's all right. So if we communicate effectively, patient safety can be ensured. and patient safety is directly our responsibility. So therefore, it's not just about a patient, but for us also it's important. Now, if we communicate effectively with our team members, for example, uh, healthcare itself is a teamwork. There are doctors, nurses, paramedical staff, technicians in the background, then there are dietitians, there are healthcare, sentry workers, security staff. And if you don't communicate effectively with each other, definitely there'll be a lot of friction. And those who communicate well with their team members, they are respectful, they are caring, they are empathic with their team. You will see that their friction level will be much lower than others, and you can imagine yourself and others how they behave. Also, if you communicate effectively with your team members and with patients and others, there will be reduced conflict. Studies suggest that even the physician burnout would go down if you communicate effectively with your team member. Yes, Dr. Ravi, you wish to say something. Go ahead, please.
Sorry to interrupt, ma'am. I just, wanted to ask you, see, we are very serious about our work and with our patients, and a lot of our staff, they may not be paramedicals also. They are, others whom we employ. And we have to be rather stern, strict about the whole thing. And that sometimes creates so you will be helping us to communicate with our staff also, because I always come across as a very stern, boss who is angry most of the time, but it's only for that nothing goes wrong with the patients.
Absolutely.
So that was just one of my, concerns.
This is going to be one of the very important topic we are going to talk about. So one, you will get to know about your communication style. I'll be giving you a questionnaire. You will be doing a self-assessment, and based on your scores, you will get to know what is your, default communication style. Like you have admitted very honestly that I'm more stern and more, strict with my staff. So because we think that's the way to handle, but during the program, we are going to talk about what are the other ways to say the same thing, not in a rude manner, but firm manner. So we are going to talk at length about assertive communication. And we'll be having a presentation, we'll be having a video around it to tell you. And I have enacted in that video, same situation I've handled in 4 different ways. And you will see a difference between the way I'm handling that situation. And you will get an idea, how do you communicate even most difficult things, whether it is patient, their family member, or your staff member, in a firm but not rude manner. So what all comes in that, we will be talking in one of these sessions. But thank you for asking that question. We'll definitely have it. So definitely, if you will learn how to communicate with your staff, still not compromise on the quality of work and send them happy, your conflict with them will go down. They'll actually give their 100%, because see, ultimately, where do we give 100%? Where we are happy. Otherwise, you will see your staff doing just bare minimum what is required. Rather, under stress, under conflict, they'll be making more errors. They'll actually be scared that, oh, I shouldn't make an error, and they'll make an error because they are scared of the situation. But if you're able to create that professional environment where they stay relaxed but still committed and responsible, and how do you communicate that? We'll be talking about that. Very interesting study. I'm sure some of you may have come across. According to Joint Commission, medical errors are third commonest cause of death. Around 250,000 patients die every year because of the medical errors. Can you believe this? And this is a study for US. We haven't done any study in our country. I don't know if we did, where we will stand. A country that works so meticulously, if they have come out with these figures, you can well imagine where do we stand. And do you know, most of these errors are because of the communication failure. 60 to 70% of the errors are because of the communication failure, where we either don't communicate properly, or we don't document properly, or we do not check whether the person has really understood what I'm saying. So we normally think, if I have written, I've done my communication. Or if I've said, I've done my communication. quite possible that itself has not happened. Communication actually has not happened. This is another study by Professor Ashish Jha from Harvard University, and he estimated that 5.2 million medical errors happen annually in India. I'm not sure if this is the right estimation. My fear says it could be much more than this. And medical errors like wrong site surgery, wrong medication, wrong organ removal, wrong treatment, wrong patient are very common, Only thing is we don't get to know because we don't make any record, because we don't document. गलती करने वाले भी हम हैं, बताने वाले भी हम हैं, छुपाने वाले भी हम हैं. Who will come and tell that, okay, we have done this mistake? And most of these errors are around medication and patient care. Around 18% are around the surgery or other procedures. So you can well imagine the number of errors that are happening in patient care just because of inadequate or inappropriate communication. So healthcare communication is not just about niceties. This is one area we need to really understand why we need to communicate effectively. The patient safety and continuity of care are two primary objectives of the. Unfortunately, most of us are working in our silos, and each one of us do our work, but we do not communicate. We do not coordinate. If there are two specialists working on one patient, if there are two doctors working on one patient, they'll be working in their independent vertical. They will not coordinate, they will not communicate. And especially diseases like hypertension, diabetes, and other chronic diseases, one doctor will think, okay, the other doctor is already treating, so let me not get into it. The second might think, okay, the patient is going to the physician, so the physician will say. A lot of times, all these things, lead to a lot of communication failure and medical error in patient care. So, how many of you? Okay, there's a statement. Let me read it. Dr. Vaibhavi has written, communication is made robust by standardized checklist. Yes, I think that's where we are moving towards the right direction. We really need to follow this. I think one of the major reasons why we are failing is we are refusing to follow the protocols. If I say somebody, there's a checklist, follow this checklist, you will not make errors. People are not able to follow them. There's a very beautiful book called Checklist Manifesto. I don't know how many of you have read it, by, what is his name? Atul Gawande. He's a doctor, he's a neurosurgeon, born to NRI parents who are doctors in US, and he's in Harvard. Atul Gawande, it's a book called Checklist Manifesto. You must read this book. It talks so beautifully about why do we need checklists, why do we need protocols, why we need to have a system. Because now, see, there was a time a doctor would have a table and a small box of medicine, A, B, C, D, E. And for every disease, he knew either antibiotic or paracetamol or anti-inflammatory or painkiller, those 5-10 diseases. Medicine. Today, the whole ICD-10 में कितनी diseases हैं? कितनी में? I was reading that article. Some 12,000 something diagnoses. अब तो 11 की बात करें, ICD-10 11 या 12 की बात करें. Some 12,000. Nobody can remember. No, it's practically impossible to remember. In another study, he talked 178 interactions are done with the patient who is in ICU in a cycle of 24 hours. How is it practically possible to remember those 178 actions done for the patient unless you document, unless you follow a system? So problem with us is we are not ready to follow that. Actually, healthcare is considered more dangerous than aviation industry and nuclear industry. It is safer to fly. It is safer to work in nuclear industry than to get admitted into a hospital. And most of the communication errors are not done by patients. You may think patients sunte nahi hai, samajhte nahi hai, unko aata nahi hai. Nahi. That's because of the internal communication failure that we have. So I want to do a small activity, but I think I'll do it in the next session because we are just left with 10 minutes. And this activity is very interesting, very enjoyable, but I'll do it in the next session in the coming week. So as I said, that most of these errors are done by us because we do not communicate effectively. And if we did that, trust me, medical errors can be reduced. So as Dr. Vaibhavi said, use of protocols, use of checklist can help us reduce these medical errors. Even the risk of allegation of medical negligence can be reduced if we communicate effectively. Studies suggest in 71% of the cases where the patient had sued the hospital or the doctors for medical negligence, the problem was not negligence. It was communication failure. In another study, they have found out that patients don't sue for negligence. They are unhappy because of the ineffective communication. And that's why they sue the hospital or the doctors. Communications like breaking of bad news, end of life care, grief counseling, they are very sensitive communication and it requires training. Unfortunately, we don't train our doctors or healthcare professionals into something like this. So as a result, mostly people are unsatisfied when they are handled, or when they are. So this is another study in which 79% of the patients and 68% of the family said bad news encounter was suboptimal because either the physician was too blunt, or the timing or the place was not appropriate, or they got a sense that there is no hope and it's a kind of a gone case. They wanted the physician to balance between the sensitivity and honesty. So that's a skill that we can learn, and that has to be learned. Only then we can, 1 second, Rashmi probably got off. Yeah. So, but usually we have challenge doing this. Even the risk of violence can be reduced if you communicate effectively with the patient. So see, imagine the benefits that we are talking about. Of course, as you said, professional satisfaction will be happy because when your patient goes happy, when you see a smile on your patient, automatically you feel happy and elated and you go back satisfied. At the end of the day, I think these are a couple of things that matter to us and we have to value them and integrate in our way of communication. So now you can well see patients are benefited, you are benefited, and it's not just patient and you, even your organization will be benefited. For example, if we communicate effectively, definitely the work environment is good. Everybody will be cheerful, happy, enjoying in that place. There will be greater job satisfaction. Patient experience score will be high. Improved patient loyalty. Patient will feel like coming back to you. They will feel like continuing their treatment with you. And of course, they would like to even recommend you to other organizations or to other patients and other relatives. And patients' safety and quality of care automatically will become better. So in nutshell, I think we have to understand it's not about niceties. Communication is not just about niceties. I think the soft skill component is just one part of it. If I behave well with you, if I start well with you, you all will be happy. But then I have to do my work in a systematic manner. Only then you will be satisfied. I can't sit and talk for 2 hours and give you stories and make you happy. No, I have to deliver you content in the right manner. So it's not about niceties. It's actually the therapeutic communication that happens between you and your patient. So you have to understand what all makes part of that therapeutic communication. It is the communication that happens between you and your team members, and that's clinical communication, where there is a greater risk of error and creating confusion and suboptimal care. And then of course, implementing communication practices has a direct impact on the continuity of care, patient safety, and treatment outcome. You can look after all 3 things, and I think these are the 3 primary goals of any healthcare delivery system. If you can communicate effectively, you can look after all these things. And there are protocols. We are going to talk about them at length in the future session. Anybody and everybody who is handling patients should know about these protocols. They are not optional. We all must know what is the right way of doing it. And there are multiple ways to learn these protocols. One is the one which you have joined this program. So with this, we come to the end of the discussion, but any questions if you have around what we have discussed, I'll be happy to take. We have another 5 minutes before we close.
Ma'am, though I don't have a question, but I'll just take 1 minute. The importance of healthcare communication, which we did not, we learned it by doing it. Like, ma'am, 1 year I was in Afghanistan. So that when we had gone there, we did not know the language over there. But fortunately, since we were Hindi-speaking people, and majority of the patients, they knew some bit of Hindi because thanks to our Indian movies and the serials they used to watch. And there was, and since we were part of a medical mission, ma'am, and there were other medical missions from various countries over there. And there was a one particular mission which was of our opposing nation also, ma'am. So, but we used to have, and these were the times when I used to be a pretty decent clinician. So, and we used to get the maximum number of patients other than because our patients used to tell us that the way the Indian doctors speak to them regarding their ailments or whatever problems they used to have, in spite of the language barrier we had, we used to communicate through our interpreters, and then over a period of time I learned the language also. So that made a lot of difference. So from a patient daily, and we used to have a daily patient of about 200. We used to see about 200 to 300 patients per day. So, but that never dent us, and the importance of communication we realized at that time itself.
Absolutely.
That how sorry
See,
for
language
just
brings us together. Language binds us. That's very, very important, because then you get to see, I mean, what exactly you're saying. But then I think overall approach also matters. If they can see that for warmth and compassion in your approach, even if you don't understand the language, even that is valued very highly. A lot of time you will have patients who don't understand your language, but still they feel satisfied that you have been compassionate, you have been empathic, you have tried to conversate with them, or at least listen to them, or try to understand their concern. I think you could successfully do that, and that's so good. Thank you for sharing that experience. Thank you. Any question or any other point? Somebody? Yes, Dr. Ravi, you wish to say something. Go ahead, please. Yeah.
Very often, ma'am, I think on a day-to-day basis, we find a lot of patients who are very stubborn. They will not listen to you, and that becomes quite a challenge. I mean, from my point of view, I can say, you'll prescribe glasses and they will say, no, I will not wear. And, or so, that is also a very big challenge where we are being nice to them, we are doing everything, but you're just sometimes facing a brick
How do you
wall.
handle it? How do you handle it ultimately?
We just, we tell them that the medically how important it is. And sometimes, we just tell them at least try to work out some compromise formula, start with it, try it out.
So that means sometimes they act stubborn because of lack of knowledge, or they are not aware what role eyes play in our life. In my husband is also an ophthalmologist, so I know what you are facing. So I remember there were patients, whose parents would not agree for spectacles for their children because they don't want their children to wear specs, especially for daughters. They would not agree. शादी करनी है, शादी नहीं होगी अगर हमने इस पे चश्मा लगा दिया. I completely agree, but there, I think probably that's where counseling plays a very big role, where you can actually help them understand that why we need eyes and how do eyes play a role in our growth and development and even intellectual development. So there we need to be more patient because they are not understanding. Again, assertion will play a very big role. At the end, if I am explaining well, if I'm counseling well, and if the patient does not agree, if I have explained the risk and the disadvantage of not using it, my responsibility, at least duty, is over because I've done my job. And after that, I don't have to be angry or annoyed with the patient, because if the patient has not understood, that's patient's choice. So I remember I was interacting with a doctor who is a diabetologist with Apollo. He said that we have, nurses and other staff who are trained in diabetes. A lot of frequently asked questions are very well managed by these nurses. So before these patients would come to them, they will actually be assessed and interacted by the nurses who are diabetic nurses, who would actually take all the history, do blood sampling and everything, and also ask about the diet and lifestyle and medicines and note down. And then the patient will go to the doctor. After seeing the doctor, the patient will go back to the same nurse. Now, this nurse will further explain whatever the doctor has explained or change the medicine or whatever other recommendations the doctor has done. So a lot of time you will not be able to give that much of time to your patient because of the overwork that you have and the responsibility that you hold. But patient's communication needs have to be fulfilled. So please bridge the gap by having right people in that place who can do that communication and counseling for you. So just to share with you, I'm working with Orbis International, who are into community ophthalmology. I did around 6 programs last year on patient counseling, where we were training optometrists to become patient counselors because they are more in touch with the patient than the ophthalmologist. So we trained them into counseling. How do you go about, counseling about squint, surgery, and glaucoma and other retinal diseases. We had classified it 5-6 categories. That means if that person can speak on your behalf, your job becomes easy. But I can't say that I don't have time and I can't do it, or I lose my patience, or we have to bridge that gap. Thank you. Thank you for asking that question. Any question or anything? Dr. Kapoor, I think, wants to say something. Go ahead, please.
Similar issues are faced, resistant communications, when you are talking about family planning issues, man. Very, very difficult communication that happens. And somehow the decision maker is not the patient there. Decision maker is somewhere at home, whom you are not really able to communicate us. That's another issue which we keep on facing over there. Another thing which I really feel is critical is adolescent communication. Yes. I deal with a lot of adolescents, and their issues are so difficult, and their peer pressure is so much that you are really able to cope up with them. How are you going to bring them out of this peer pressure? Third group I'm really dealing with is HIV/AIDS groups. I'm still in charge of HIV. They just come and sit silent in front of you and don't speak a single word. Sometimes they start crying only. So that's a communication they're doing with you. We're just sitting silent over there, and you have to understand what state of mind they're going into this. So it is very difficult issues which we are going to talk over in the next sessions. I'm really looking forward to those sessions, ma'am.
Thank you. So I think in one line, what I would say, you all communicate and care for your patient. I don't doubt it. If you're here, I'm sure you care for your patient. One word that I want to add to your communication is connect, communicate, care. So add this connection. If you are able to connect with your patient is all yours. Unfortunately, we don't connect. We don't build rapport. We don't make them comfortable. We don't treat them as equal. We are not respectful. We consider them less than us. So if that's the way I'm handling, I've failed to connect with them. I have to first win their confidence. I have to tell them I'm your well-wisher. I'm here for you. And I'm not going to feel bad if you don't agree with me, but I will make my best effort to help you understand. And we will be doing a lot of role plays. That's the way I normally impart skills. So you will really enjoy it, because even when the patient is aggressive, not agreeing, uncooperative, how do you build connection and assert and turn the table? That's what we are going to learn in the program. That's the way.
Shah Rukh Khan's dialogue, "Main hoon na," that should be complicated. I always say that line. The patient should go with the line. That "main hoon na."
अच्छा, आप अपने बच्चे के लिए स्कूल जाते हैं, टीचर को जाके बताते हैं ये प्रॉब्लम है, टीचर पूरी बात सुनती है और आपको और 4 बातें बता देती है. ऑन द कॉन्ट्ररी, अगर वो आपसे कहती है डोंट वरी, वी विल वर्क ऑन दिस टाइप प्रॉब्लम, इट्स ऑल राइट. बहुत सारे बच्चे ऐसे होते हैं. दिस इज पार्ट ऑफ ग्रोइंग अप. हाउ डू यू फील देयर? Immediately you feel, oh, this person has understood my problem. And that's what we need to work on. So I know it's already 5 minutes past 10. Two requests I wish to make. I had circulated brief introduction forms in the group. Some of you have done it, some of you haven't done it. I need everybody to complete that form. Brief introduction of each one of you. That helps me to make sure that I cater to your needs, training needs, because I have asked a couple of questions where I need to understand what are your training needs, what are your expectations. That's one thing. And feedback form for this session, I'm going to again add in the group, not here because it's already 5 minutes past 10. I can see some of you are very tired and sleepy. I don't want to hold you further, but you have to, give me feedback. I read each and every feedback very seriously. I don't close till I've gone through everybody's feedback. I close that window only once I've gone through. I make a mental note of it to make sure whatever you have advised, I will add it to my next session. So I want two things to be completed. One is brief introduction and second is feedback. I will not hold you further. I know it's already 5 minutes past 10. Please go ahead, have your food, take good night's sleep, feel good. Let's meet next week. So next week, Sharvano is asking for Friday. Although honestly, Friday does not suit me because it's my husband's weekly off. But I can still forgo if everybody agrees, because I want Dr. Sharvano to attend this session, because Dr. Shafazo and Dr. Sharvano has not been able to attend the last time also because they are very busy during other days. Are you all okay if we do it on Friday? Everybody's okay with Friday? So we freeze it to Friday? Thank you. Let's meet next Friday, 8 o'clock. Thank you so much. Bye-bye. Good night. Take care.
Good night.